Welcome to Mod 115, Introduction to Transcultural Communications. We will begin this week, Week 1, in Chapter 1. Week 1's topics will include introductions to vulnerable populations and transcultural communications. Transcultural communications is designed for all healthcare providers and students in the helping profession. Anyone who interacts with cultural diverse patients and families needs to learn transcultural communication principles and techniques. In this society, with its continual changing racial, ethnic, and cultural demographics, opportunity for intercultural communications has accelerated. The book is focused on nursing practice, but has content that is highly relevant to the practice of all helping professionals working with culturally diverse clients and their families. First, we will take a look at the definition of cultural competent care. It is defined by the American Academy of Nursing as a complex integration of knowledge, attitudes, and skills that enhance cross-cultural communication and appropriate and effective interactions. It involves cultural awareness, cultural knowledge, cultural skills, and cultural encounters and cultural desires. The next definition that we'll look at is DAD. This is an interaction between two people, which is the most common form of communication in a healthcare setting. Communication is an exchange process. It's not a one-sided delivery of information. Let's take a look at the communication cycle. It begins with a sender who encodes the message, using a channel to transfer the message, whether it be verbal, email, or phone. The receiver is the person who is receiving the message, and they must decode the message, meaning they must fully understand what the message is. It works most effectively when feedback is utilized to ensure the message was properly decoded. So if you ask someone, for example, to deliver a package to an address, the best effective way to make sure that the message is being understood is to repeat what's being asked, and preferably in detail. Therefore saying, so you would like this package delivered to Mr. Smith at such and such an address. And that way, the person that's given the message knows that the person receiving has completely understood what the message is. Anything that can interrupt the way a message is being decoded is considered noise. Therefore, if someone doesn't understand the instructions properly or the message, there can be a misunderstanding in the communication. This noise can come as physical noise, such as cell phone static, psychological noise, such as defensiveness or attitudes, and physiological noise, such as a hearing deficit or accents. Let's take a look at languages. There are 6,000 languages spoken around the world. The most common international languages are Mandarin Chinese, which are over 800 million speakers, English, that has over 400 million speakers, and Spanish, which has over 300 million speakers, and then Hindu, over 300 million speakers. Body language is another form of communication. It is a nonverbal communication style. The process of communicating through sending and receiving wordless messages. It can be communicated through gesture and touch, by body language or posture, by facial expressions and eye contact, and through object communication such as clothing, hairstyle, or even architecture. Paul Ekman's 1960s studies of facial expressions determined that certain expressions are universal, meaning that all cultures have these common expressions: anger, disgust, fear, joy, sadness, and surprise. Research has suggested that between 60 and 70% of all meaning is derived from nonverbal behavior. Hagel, 1970, put forward the hypothesis that whereas spoken language is normally used for communicating information, nonverbal codes are used to communicate attitudes. On average, to a moderate degree, women are better at nonverbal communication than are men. So why is transcultural communication important? One, it has increased in ethnic, racial, and cultural diversity in the composition of the U.S. population. Patients have a variety of expectations and behaviors within the context of healthcare. And health issues have cultural meaning within specific societies. Transcultural communication is also important because it has a level of adherence and compliance with treatment often depends upon integrating specific cultural factors, such as religious interventions. The concept of health varies from culture to culture. Therefore, the way that a patient approaches their health care will be better understood when understanding their cultural values. Healthcare has a commitment to humanistic and humane treatment for all patients. Take a few minutes to look over the chart of the census data of 2010. Note that 35 million Americans speak Spanish primarily in their home. That's over 10% of the population. And 7 million Americans speak an Asian-based language in their home. It is always important to remember, when communicating with a patient or a client from another culture, what you need to know. One is how and when to start the conversation. Two, how best to be understood. For example, you may need an interpreter. Three, how to respond to a patient's gestures or questions. Four, how to be sensitive to the patient's reactions. 5, how to listen to the patient's concerns. And 6, how to take the patient's illness and health-related beliefs into consideration as you plan for their care.